The cervical plexus is a conglomeration of the cervical nerves. This means that they are nerves in a cluster. The location is in the anterior rami of the first four spinal nerves C1 to C4. This is right at the top of the spine in the cervical vertebrae, also known as the neck bones. These cervical vertebrae have an opening inside them called the transverse foramen, which the nerves come out of. All of these nerves are connected to the spinal cord. The root area is yellow on the diagram, and that's the part that connects to the spinal cord. And the green area is the part that connects to other parts of the body. For example, C3 root is joined with the phrenic nerve that causes the contraction of the diaphragm. So we have here our nerves and their distribution and their origin or their location. So the first nerve I have here is the lesser occipital. So its origin is C2, and the distribution is the skin of the scalp and some of the ear as well. And the great articular nerve, its origin C2 to C3. The skin of the anterior inferior and some of your ear and your parotid glands as well. Transverse cervical, C2 to C3. Skin over anterior and the lateral aspect of the neck. Supraclavicle, C3 to C4. Skin over the superior portion of the chest and the shoulder. So they are all sensory branches, and now we have our motor branches. So we have our superior root. Its origin is C1, and the distribution is infrahyoid and some of the muscles of the neck. The inferior root, C2 to C3, some of the muscles of the neck as well, and the phrenic nerve, which we mentioned before, C3 to C5. And this contracts the diaphragm. Segmental branches are from C1 to C5, and this distribution is for the deeper muscles of the neck